Chief Minister Siddaramaiah held a review meeting at his residence Kaveri with health officials and ministers to assess the current COVID-19 situation in Karnataka. While stressing there's no need to panic, the Chief Minister asked officials to stay fully prepared. He instructed health departments to ensure ventilators, oxygen, and medicines are available if needed in the future. Hospitals must be equipped with beds and essential supplies. A COVID helpline will be launched and airport screenings may resume if needed. Vaccines should be kept ready and public updates will be shared through social media. He advised elderly people, pregnant women, and those with health issues to wear masks and urged awareness campaigns. Weekly or more frequent reviews will be held to monitor the situation. Hospitals have been told to be ready to treat pregnant women without transferring them. Schools should send home children with a cold or fever, and parents are advised to keep sick children at home. Officials reported 62 COVID cases in the fourth week of May, with only one serious case. Neighbouring states are also seeing a rise. Health staff were told not to take leave, and all government guidelines are being followed.